What's going on, everyone? Happy Saturday. Hopefully, everyone is doing well, staying safe, healthy, testing negative for all those viruses that can make us sick, and having a great day so far. It is time now for the Saturday edition of the Virus Update for Saturday, September 27th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there. COVID is still a thing, and you know what? We're not too far away from winter. Yeah, fall just started, but the cold season viruses, colds, flu, RSV, norovirus, other viruses, they're going to be joining the mix pretty soon as well. Well, you need to be informed on the progress of these viruses, what's going on, the various different levels, the news, the data, wastewater. That's what I do here on my channel. If you want to stay informed, subscribe down below. If you like today's video, give it a thumbs up. Hit that notification bell. Share this video with anyone you know. Leave your comments down below, and ways to support the channel are listed down below. Alrighty, we do have a very busy Saturday edition of the Virus Update for you today. We do have several news stories to take a look at. We do have some data from CJS, and we'll take a look at some of the daily stuff as well. All right, starting off with this from Mike Horker. Breaking, this is breaking as of yesterday, CDC COVID transmission surges across the Northeast amid 11th wave. And when I say CDC COVID transmission, he's talking about his PMC product here, which he uses the wastewater data from the CDC. Yeah, this is really not good what's going on in the Northeast. You can see here, they show how many people could be infected. Like, example, Pennsylvania, 1 in 61. New York State, 1 in 35. Massachusetts, we actually got a request to mention Massachusetts. You're going to see Massachusetts twice today. This is the first time you're seeing Massachusetts. I always like to leave sticky notes. I know they're old-fashioned, but I like good old-fashioned sticky notes. If I see a comment where someone says, hey, could you show such and such area, I'll make a little note and show it. So if you have a request for something you're not seeing, let me know. If I can find something, or if I'm educated on the subject, I will try and share that. So Massachusetts, 1 in 37 people are positive for COVID. Connecticut, this is really bad. Connecticut's the worst in the Northeast right now. 1 in 18, 1 in 33 in Rhode Island, 1 in 40 in Maine, 1 in 59 in New Hampshire, 1 in 69 in the state of Vermont, and you can see here, New Jersey is 1 in 82, but again, Connecticut, very high at 1 in 18. That's not good whatsoever. New York has high transmission at this time. We've been watching New York, and you can see, take a look at this, down around New York City. I'm actually impressed here. Look at this map closely. Yeah, are you seeing something that we haven't seen in a while? And you're probably going, what's he talking about? Okay, as we all know on the CDC wastewater maps, or maybe you didn't notice. If you didn't know it, gray stands for no data. And New York State has pretty much been in a data blackout for some time. I mean, yeah, there's been some wastewater sites, but many of them just have not been updating. Well, take a look at this. More of them are now updating, and with the ones that are updating, we do see here the very high shade is showing up a lot in the New York City area. And when that's zoomed in, you do see anywhere from moderate to very high showing up in a lot of places. Then you follow that New York State Thruway corridor. Yeah, there's still some grayed out, no data areas, but we also do see some very high areas there. And take a look at Connecticut, where statewide coverage is very good. Yeah, Connecticut's not doing all that great, with that 1 to 18 estimated to be actively infectious. Massachusetts, again, Massachusetts, you could use some more wastewater sites. I wish we had wastewater like Cape Cod, that whole Cape, that peninsula, or whatever you want to call it. I wish you had more wastewater coverage. Rhode Island, high, but we do see some very high areas near Providence, Rhode Island. So, yeah, you get the idea here. The Northeast is still off doing its own thing. We know the Northeast for wastewater is still rising. All right, let's talk about the national picture for a moment and talk about something completely different. Not active infections, but the vaccine. Yes, 25 states now. This is coming from Dr. Lucky Tran. 25 states now, plus D.C., which is not a state, have taken actions to protect COVID-19 vaccine access two regional public health alliances have formed: the Northeast Public Health Collaborative and the West Coast Health Alliance. Several Midwest and Mountain states have collaboration potential. So there could be more. And you see here in the blue, there's the Northeast, in the yellow, there's the West, and then this pinkish purple color, I guess we'll call it. You can see here that there are several states that have potential. So this is definitely progress in the right direction. And you know our stance here on the channel is you do whatever feels right to you. If you don't want to get a vaccine for COVID, that by all means, that's your choice. Don't get one. But if you do want to get one, then by all means, go out and get one. And with that West Coast Health Alliance, we do see, I want to mention this, Washington, Oregon, California, and Hawaii. Alaska is not in that. I don't know that they will be because Alaska is more of a red state. You notice here, the majority of these states that either have potential or have done something at the moment, they are relatively, I hate getting political, but they are more so blue states, Democratic states. And that's where we're going to leave it at that. All right, moving on now to Dennis, the COVID info guy. The UK COVID rise, I mean, you can't deny it at this point. COVID's going up there. I also saw something from the UK Health Security saying that flu is starting to come into the picture. So, yeah, they're using an indication of what's to come as well for flu here in the United States. Although, I think things have flipped when it comes to COVID. In the early days of the pandemic, it used to be the UK was an indicator of what's to come here in the United States. That's not the case anymore. The UK sometimes will either do its own thing or they will follow what has already happened here in the United States. And they've been in a long rotation, gradual, slow, and steady rise here in the UK that continuously gets worse. Yes, longer periods of time of high-risk infectious periods. Okay, in the UK, by September 10th, there was a 7.6% rise for COVID. The XFG.3 variant now makes up a larger share of the infections. Unlike other variants, Stratus has certain mutations in the spike protein which could help it evade, antibodies from prior infections or vaccinations. So, yeah, COVID is on the rise there, and it's going to continue to be an issue in the UK. And check out this. This is not good at all. COVID in England. Weekly A&E. A&E stands for Accident and Emergency. That's their way of saying emergency. Hospital visits there. Attendances for COVID-like illness in England, they are going up significantly. Data to week 38, ending September 21st, 2025. The weekly total for week 38 is 42% higher than that for week 37. The level in week 38 is the highest since week 43 of 2024. And you can see that here. It is a significant increase. And like I said, in the UK in general, which would include England, flu is starting to enter the mix as well. So maybe some of this is flu as well. We'll take a look at the UK dashboard again tomorrow. We'll also take a look at flu when we do that tomorrow. We just do not have time today because there's so many things we have to get through, including this. Nearly 7 in 10 COVID survivors tested didn't know they had a dulled sense of smell. Yeah, that is a thing. I think I mentioned this the other day. I haven't seen anyone do the test in a while. I'm going to have to search X and see if anyone's been doing this. Or maybe I'll go and do my own search of the reviews for the Yankee Candle. It's a thing. A lot of people, when COVID goes up or post a major COVID wave, a lot of people leave bad reviews to Yankee Candle. It's true. And they say, I'm not really smelling the scent with your candles anymore. Hi, if you have had COVID, maybe you actively have COVID or just had COVID, you may lose your sense of smell. And 7 to 10 people tested didn't know they had a dull sense of smell. And I'm sure some of these people may have even left a review for Yankee Candles saying, I just can't really smell your candles right now. Yeah, it's a thing with COVID. It really wasn't a thing before COVID entered the picture in 2020. Some will say they may have had it in late 2019, which is entirely possible. But yeah, this is a study that is really making waves. Hey, there were almost 3,000 people in this study, and a lot of people didn't realize that. Wow, yeah, my sense of smell, yeah, it's not as good as it used to be. And I know several people in real life that actually are saying, yeah, my smell's not so good. I know a few people that are saying they still can't taste properly. Some that even never actually tested positive for COVID. They may have had an asymptomatic case that was not picked up. And we do know asymptomatic cases can lead to issues as well. There are actually several people in the COVID cautious community that report of having issues from a case with no symptoms. They tested positive, they had no symptoms, and now they're having all these issues several months later, or even years later. All right, take a look at this. Sharp rise in memory and thinking problems among U.S. adults, study finds. A growing number of U.S. adults, particularly under 40, are reporting serious challenges with memory, concentration, decision making, according to a new study in neurology. Yikes, this is not good. Under 40 now. This is a younger age. So if the virus is able to do problems in under 40, imagine what it's doing to people who are older ages. Yes, and this study with the increasing number of people having these problems, and okay, the trends, some of this data comes pre-COVID, but the majority of it is during the COVID era. And Dennis, the COVID info guy, says, gee, I wonder what could possibly be causing this. Yeah, I wonder. Well, we have several studies. You can go over to my website. They're in the studies section and click on COVID's link to the brain. I believe it's what we call. Matter of fact, let's go over to the website right now. You go to my homepage, datareport.info, and yeah, there it is. COVID's effect on the brain. And look at that. There's 35 different topics in there. Accelerated brain aging during the COVID-19 pandemic. There's a lot of things that talk about COVID causing issues on the brain. Yeah, hello. Part of this problem here could be from COVID causing issues in the brain. And I know sometimes, for me, I deal with long COVID. Every once in a rare while, I will just totally lose track. You may even notice it in some of these videos of what I'm doing, what's going on. It can definitely be linked to COVID because prior to case 1 and case 2, I was sharp as a pinpoint. I wasn't really forgetting things all that often. And once in a while, it does happen. Like, wait, what was I just doing? Yeah, I can get all mixed up. It's still is a thing. It was more noticeable after the second case, and here we are. What are we? Almost into October, so we'll say 9 months now. Yeah, just about 9 months since I have had tested positive. All right, switching gears. Measles. South Carolina reports 4th measles case in 2025. Officials have confirmed South Carolina's 4th measles case. As you know, measles has been a problem here in the United States. And now get this. Over in New Zealand, 4 measles cases identified in Northland. Yes, New Zealand is now dealing with some measles cases. We haven't heard about this in a very long time, and all 4 of the cases are in isolation and are being monitored for symptoms and receiving support from public health, which was working to rapidly identify close contacts and ensure these people quarantine as required. All right, moving on now. We do have Lubbock, Texas is dealing with a West Nile virus case. I think almost every day this week we've talked about West Nile virus, and I bet we're not done with it yet. I'm sure tomorrow is going to be a busy news day because I actually stopped adding news stories for today's video because, as you see, there are so many, which some are leading to discussion such as this. An update on Steve Martin. Apparently, or so I can assume, Steve Martin has now tested negative for COVID. Yes, I mean, oh so quick. And this just goes to show you that maybe he's fine, maybe he's not. I think he's fine, because what you're about to hear is going to really surprise you. You're going to go, you're going to facepalm and like, what? Yeah, but COVID really affects everyone different. 1 week, Steve Martin's fine, and for me, it was roughly about a month or 30 days before I went back to work. I mean, I tested positive, and then I was really sick, and then I felt a little better. We had snow, and some are going to probably frown upon me doing this. I actually went out and shoveled snow. We had some snow, and then within a day later, or 2 later, oh, man, my head is really starting to hurt once again. It's like, what the heck? And then positive once again, and that was what really did me in. And maybe part of it's my fault. I shouldn't have shoveled snow. I know, you're supposed to rest as much as possible, but snow's one of my favorite things, so... Yeah, the point I'm trying to come across is COVID hits everybody different. Some people are good in a few days. Some people, it takes a long time. Some people then go on to develop long COVID. I already had long COVID, which was improving until another case came along, and now here we are back at square one. But, yeah, Steve Martin, I don't get it. Now he's going to attend another big event that could very well be a super spreader. He's going to Selena Gomez's wedding in California. Does anybody ever learn a lesson when they get COVID that maybe big events are not such a good thing? It's so easy to get COVID. I don't know, and I really like Steve Martin as an actor. I have seen so many of his movies. I like his banjo playing. I think he's a great comedian. I don't know. Moving on now. Let's take a look at bird migration just real quickly. Honestly, I should have probably skipped over this for today, but we'll take a look at it. Bird migration does lead to bird flu. We're seeing an increase in bird flu. We've been seeing up to 1 billion birds at nighttime migrate to the south. I don't think we see that here, do we? No, we get close to 800 million, and that is about it. Heavy migration in the northeast, heavy migration in the northern plains and in the south. I can report to you, we have officially, as of, what was it, Wednesday or Thursday, we took down our hummingbird feeders. Weren't seeing anymore, so we stopped. Another neighbor reported still seeing just one hummingbird. But it was a late start for us, but in the end result, we did see several hummingbirds migrate south. Several hummingbirds throughout the winter, and now they are migrating to the south. All right, moving on. Let's take a look at what's going on with air qualities. Skipping over Canada today, we will take a look at that tomorrow. Tomorrow will probably be another busy day here for the update because I said I stopped doing my searches. I didn't type in bird flu. I didn't type in TV like I would. There were several things I didn't type in, and then plus, of course, whatever else pops up. So tomorrow looks to be a busy day. The Northwest still dealing with wildfires. It is still wildfire season. It's extending itself this year. I think it's going to continue into October, maybe even early November this year. That's leading to bad air qualities out there. All right, moving on. We'll take a look at Philadelphia EMS calls. We're skipping over Florida for today. We got to get to that data from CJS. Did Philadelphia come in? As of earlier, they did not. Still stuck on Thursday. Okay, let's just take a look at some local EMS calls, because last I saw, it was a busy Saturday here. We do see respiratory emergency, a few other things popping up in Montgomery County, Pennsylvania, and Chester County, Pennsylvania. Whoa, I'm seeing a lot of calls here, but I'm also seeing EMS standby, so that really inflates this quite a bit. But yes, there are calls. It's busy. Of course, you don't need me to repeat saying this. I'm very concerned what's happening up in Central Pennsylvania today. That is where there is a huge Penn State game. I watched the ESPN College Game Day this morning. People were pretty much elbow to elbow with each other. COVID was already high up there. It's going to continue to be high. It may even reach very high in Center County, Pennsylvania. Hospital situation, not terrible today in Pennsylvania, but Lehigh Valley has been on the busy side all this week. Let's see what's going on with the hospitals in New Jersey. We'll take a look at New Jersey's weekly respiratory report tomorrow. Hey, we're going to have a lot of things tomorrow. It's going to be a long video. Cooper University Hospital, full and total divert for patient volume. And that is it for New Jersey. All right, let's get over to that data from CJS, and then that will be it for today's video. Taking a look here, we don't have the full and complete numbers. There'll be some more numbers next week. CDC has delayed doing the death update. I don't know when that's going to be coming once again, but here's the numbers that we do have from CJS. Florida, 491 new cases and 20 deaths on Thursday. These are Thursday numbers at first. New York, daily numbers, 1,023 new cases. Puerto Rico, 240 new cases. Massachusetts, here's the second thing for you. Weekly cases, a net of 1,600 new cases, 228 CDC reported hospitalizations, and 15 new state reported deaths. Minnesota, a weekly number of 1,145 new cases, 104 CDC reported hospitalizations, and 3 new state reported deaths. Hey, tomorrow is Wastewater Sunday. I am going to be trying this week to hit up some of those states that I have not shown in some time. Arizona, New Mexico, states like that, I'm going to try and give you some attention tomorrow. I'm already going to make a note of that to myself. Friday, Florida daily number, 716 new cases and 22 new deaths reported today, and 4,887 cases and 104. That's still a high number. 104 state reported deaths reported over the past 7 days, to go along with 972 CDC reported hospitalizations. Your hospitalizations have gone below 1,000. They're still high, but they are coming down. New York, 940 new cases reported on Friday. 6,220 reported over the past 7 days, to go along with 547 CDC reported hospitalizations and 13 new deaths reported provisionally by the CDC on Thursday. Yeah, your hospitalizations, they are up there at this time. Puerto Rico, 226 new cases reported on Friday, and 1,508 cases and 14 deaths reported over the past 7 days. All 14 deaths were reported on Monday, to go along with 153 CDC reported hospitalizations. California, weekly number, 6,404 new positive tests. A test case positivity rate over the last 7 days of reporting of 9.22%, down from 10.65% last week. They clearly peaked. 1,278 CDC reported hospitalizations. That's still far too high. And 63 new state reported deaths, including one from 2024 and one from February of 2025. Louisiana, weekly number, 821 emergency department visits, a test case positivity rate of 5%, down like an anvil, he says, from 7.8% last week. 126 CDC reported hospitalizations and 5 new state reported deaths. Now, we do have some CDC hospitalization counts. Before we get to that, let's pause and take a hydration break, shall we? All right, we have some CDC hospitalization counts here. One which I am not happy about whatsoever, and I'll explain when we get to it. CDC reported hospitalizations for Alabama are 146, Arizona 138, Georgia 217, Illinois 282, Indiana 121. This is all for COVID. Kentucky 121, Michigan 178, New Jersey 291, North Carolina 438, Ohio 288, Oregon 131, Pennsylvania 557. Wait, did I just say Pennsylvania? 557? Yeah, that's my state. I'm not happy about that. Pennsylvania has a lower population than the state of New York. We have more hospitalizations than New York State. We're just doing oh so bad here in Pennsylvania. And I have to think a lot of that issue with the emergency departments being really busy in the Lehigh Valley, which is like eastern Pennsylvania, like the central portion of eastern Pennsylvania, Bethlehem, Allentown, Easton, if you ever heard of those towns. I have to think that's part of the issue, and of course, us having big super spreading events, even though they're outdoors, you got the tailgating, you got the football game, that's just only going to add to the mix. Yeah, we may peak, but are we actually going to do a fast drop? There'll be some parts of Pennsylvania that still continue to either be high or continue to rise. People come from all over state and even other states. All right, South Carolina, 150 hospitalizations. Tennessee, 141. Texas, still 778. And I have to zoom this out. My recording software is in the way. Virginia, 147. Washington, 186. Wisconsin, 157. The national hospitalization count as of Friday's reporting is 9,135. Yes, that's coming down, but we still do have some troubling states, especially here in the Northeast. California is still a problem. That would be dropping. We still need to work on that. Alrighty, that was a long virus update today, wasn't it? Tomorrow's looking to be long as well. If you enjoyed today's update, give it a thumbs up. Hit that subscribe button down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. Ways to support the channel are listed down below. I will see everyone again tomorrow for Wastewater Sunday, catch up, and whatever else pops up between now and tomorrow. Until I see you again tomorrow, stay safe, everyone. Have a fantastic Saturday afternoon, and thanks for watching.